So today we are going to study the anatomy of the cardiovascular system. Since we know that the heart contains four chambers, that is left atrium, right atrium, left ventricle and right ventricle. The left atrium is the most posterior part of the heart, that is it is placed most posteriorly and in close relation to the esophagus and vagus nerve. So during atrial enlargement, such as during mitral stenosis, it can cause compression of the esophagus, which may manifest as dysphagia, or it can cause the compression of the left recurrent laryngeal nerve, which is a branch of vagus nerve, and it may cause hoarseness. So this triad of left atrial enlargement, dysphagia, and vagus nerve compression is known as the Ortner syndrome. Just as the left atrium is placed most posteriorly, the right ventricle is the most anterior part of the heart, and it is most commonly injured during trauma to the epigastric region. Then we have pericardium. Pericardium is made up of three layers: the fibrous pericardium, the parietal pericardium, and the epicardium. Then there is pericardial space that is present between the parietal pericardium and epicardium. The pericardial space contains fluid which provides lubrication during beating of the heart. Pericardium is innervated by the phrenic nerve. Then we have pericarditis. Pericarditis is the inflammation of the pericardium, and since pericardium is supplied through the phrenic nerve, the pain of pericarditis is referred to the shoulders. Then we have coronary blood supply, that is blood supply of the heart. The blood supply of heart is through two arteries. One of them is the left coronary artery and another one is the right coronary artery. The left coronary artery gives two branches. One of them is left anterior descending artery. One is the left circumflex artery. The right coronary artery gives posterior anterior descending artery. So the left anterior descending artery supplies anterior two-thirds of the interventricular septum, anterolateral papillary muscle, and anterior surface of the left ventricle. It is the most commonly occluded artery and may cause myocardial infarction. Then we have the posterior descending artery, which supplies posterior one-third of the interventricular septum and posterior two-thirds of the ventricles and posterior medial papillary muscle. The right coronary artery supplies the AV node and SA node. Hence, the infarction of the right coronary artery may result in sinus bradycardia and nodal dysfunction. Then we have dominance. When posterior descending artery branches from the RCA, this is known as right dominance. When posterior descending artery arises from the left circumflex artery, that is a branch of left coronary artery, then that is known as the left dominant. There is third situation in which the posterior descending artery arises from the left circumflex and right coronary. This is known as codominant circulation.